Assalamu alaikum. This is Sarah from Pharmacy. I will be talking about Pharmacy Orientation Program. I'll start from medication use management. Outline. Introduction to the system of medication. Management in cash. Second is serves operations accessibility. The third is phases of medication management. Fourth will be free medical sample and fifth will be ESR. Introduction. King Abdulaziz Specialist Hospitals review the system annually according to all information and experience of management phases. 2. The pharmacy organizes and controls medications throughout the hospital with the cooperation of PT committee. Third, all policy are available in the network of the hospital. Cash, policy and procedure, pharmacy manual, choose the related policy. Services operation accessibility. We are operating pharmacy administration, like classification administration issues related to medication management. Extension number will be 2044 or 1080. Hours of operation will be 7:30 a.m. to 3:30 p.m. from Sunday to Thursday. Friday and Saturday will be off. Main pharmacy operating inpatient pharmacy 5260 extension number. ER Pharmacy also 5260 extension number. Intravenous Admixture and Total Parenteral Nutrition Unit 2045 extension. Compounding Unit 5260. Store 5261. Narcotic and Controlled Drug Section 1333. Central Medications also 1333. And we are open 24 hours around the clock on all days in a week from Saturday to Friday. Outpatient pharmacy classification is also an outpatient pharmacy. Extension number is 6612 and 6613. Hours of operation 7:30 a.m. to 3:30 p.m. from Sunday to Thursday. Friday and Saturday will be off. Drug Information Center extension will be 5424. 7:30 a.m. to 3:30 p.m. from Sunday to Thursday. Friday and Saturdays will be off. TQM and Medication Safety 5116 extension number, 7:30 a.m. to 3:30 p.m. from Sunday to Thursday. Fridays and Saturdays are off. Continuous medical education training. The extension is 5116, 7:30 a.m. to 3:30 p.m. from Sunday to Thursday. Fridays and Saturdays are also off. Repacking and Automation Unit. Automation Unit 5261, 7:30 a.m. to 3:30 p.m. from Sunday to Thursday. Fridays and Saturdays are off. Phases of medication management. Selection and procurement starting, and storage the next one. Prescribing, transcribing, preparing and dispensing, administration and monitoring, intervention and quality measures monitoring. Free medical samples is a trial package of medication. Free medical samples are prohibited in cash due to unknown quality level. Prescribing. First, medications order. Prescription is carried only in electronic order on the official forms or cash. Second is authorizations for writing prescriptions for various categories of drugs must be in accordance with policy of prescribers and their privileges, policy number PH3005/03. Doctors who are under training are not allowed to write a prescription unless it is reviewed and attested by authorized doctor of King Abdulaziz Specialist Hospital. Prescribers and their privileges. Number 1, it is a list of medications with restrictions on prescribing, ordering in cash for physicians in which some drugs are restricted for certain departments or specialties in order to confer appropriate supervision and get appropriate outcome. Second, any prescription or order containing drug which are written against the prescribers and their privileges policy will be returned. Right prescribing process. We have the 7. Number 1, complete patient information. Example, MRN, patient name, weight, specialty for specific medication, and allergies. Number 2, absence of patient-specific information is allowed only in emergency situations. Third, clear and defined indication for their use. Fourth, complete all medication information according to 7 right. The physicians assigned and stamped and used only approved abbreviations. Fifth, special precautions or procedures for ordering drugs with look alike, sound alike, generic, and brand names are required. Sixth, the use of verbal and telephone order and the exceptions for use. Seventh, physicians can prescribe medicine for 6 months. If there's no need to see the patient, but only 1 month will be dispensed to outpatient and discharged patient. All the patient information could be accessible through the electronic system to be immediately available and accessible for all the healthcare providers. Monitoring. We have 2, medication error and adverse drug reactions. Medication error, it is any preventable event that may cause inappropriate medication use or jeopardize patient safety. JCI 5th edition. Near miss is a medication error that was detected and corrected before it reached the patient. Risk. Hazardous conditions that could lead to an error such as products with look-alike packaging or names, staffing shortages that result in excessive workload. Medication error. The treating physician is notified of the medication error at the appropriate time. Caregiver who observed, involved, or discovered the medication error must document the error in patient's medical record and on the medication error reporting form. Medication error reporting should be completed within 24 hours, not more than 48 hours after error discovery. There is standard format for reporting medication errors, present in nursing station and on cash policy, pharmacy manual, medication error system. The hospital conducts intensive root cause analysis for all significant or potentially significant medication errors. Start from category D. Medication errors, near misses, and hazardous situations are documented in the patient's medical record. Adverse drug reaction. ADR is a response to a drug which is noxious and which occurs at doses normally used in humans for the prophylaxis, diagnosis, or therapy of disease or for the modification of physiological function. Side effect. It is an expected and well-known drug reaction, for example, drowsiness or dry mouth due to administration of certain antihistamines. Adverse drug reaction. The treating physician should notify at appropriate time. The time frame for reporting ADRs is 24 hours. All ADRs are documented in the patient's medical record by the healthcare professional who observes the reaction and must be reported to the pharmaceutical care department by completing an adverse drug reaction reports format. Adverse drug reaction report and Naranjo algorithm giving all the necessary information. The adverse drug reaction reports format Naranjo algorithm are available in all pharmacies, all nursing stations in the pharmacy form file which is located in the pharmacy box at nursing stations. It is also available in the network system, cash policy, policy procedure, pharmacy, manual, pharmacy policy and procedure, adverse drug reaction. Any adverse effect suspected to be associated with use of drugs should be reported. For example, new rare reaction, ADRs associated with newly marketed medications, reactions that are not listed in the manufacturer's production information, a serious reaction whether expected or not, unusual increases in numbers or severity of actions, allergic reactions. High alert medication. High alert medications are those drugs that carry a risk for errors that can lead to significant adverse outcomes. JCI 5th edition. The high alert medication list is updated annually, prepared by the Pharmaceutical Care Department, discussed and approved by PT Committee. There is a multidisciplinary plan for managing high alert medications and hazardous pharmaceutical chemicals include identification, location, labeling, storage, dispensing, administration. Please go to cash policy, pharmacy manual, policy and procedure, high alert medication folder. High alert medication at cash are, there are 14. Number one, concentrated electrolytes. Second, antithrombotic medications. Third, neuromuscular blockers. Fourth, anesthetic medication. Fifth, insulins. Sixth, narcotic and controlled medication. Seven, total parenteral nutrition. Eighth, adrenergic agonist 4. Ninth, adrenergic agonist 4. 10, inotropic medication 4. 11, chemotherapeutic agent. 12, moderate and minimal sedation agent. 13, sulfonylurea hypoglycemic agent. And 14 is the miscellaneous. Look alike and sound alike medication. Medication with drug names that look similar in print or sound, similar to other drugs when their names are spoken. This is the definition. The LASA medication list is reviewed annually, prepared by the Pharmaceutical Care Department, discussed and approved by Pharmacy and Therapeutic Committee. There is multidisciplinary policy and procedure on handling LASA medication. The hospital takes action to prevent errors involving LASA medications, including the following for physicians: identifying LASA medication pairs, using both brand and generic names, writing the diagnosis, indication of the LASA medication on the prescription, posting look-alike and sound-alike posters in all pharmacies, all nursing stations to serve as a reminder for all healthcare providers. Limit the verbal and telephone order to emergency situations only. Taking full order information, generic and brand name, indication, dosage recommendation to avoid any confusing. Read back the order, spelling out the drug names. Use technology to minimize medication errors. Example, computerized prescriber order. Tallman lettering is the practice of writing part of a medicine's name in uppercase letters to help distinguish sound-alike, look-alike medications from one another to avoid medication errors. Examples are dopamine and dobutamine. A fixed name alert on look-alike and sound-alike LASA medications cassette or cabinet. Report any errors and potentially hazardous conditions with look and sound alike product names to help developing strategies to reduce them. Kalas.